in the area that experiences some of the worst burden of ill health. The mounting of educational initiatives to the community and also to school-age children. Health screening affairs, defibrillators, the creation of a trauma center. You know, you do these things and pretty soon you have a movement. And I was a physics major. Kind of my first love in science was physics. And I like to use the concept of a center of gravity. You know, you have some of this and some of this and some of this. What you need is enough weight. You need enough leverage so that you really have a center of gravity around which things can be built. And then you can really begin to see change. And right now, it may not seem like there's that much because there's this initiative and there's this piece and there's this piece and there's that piece and we're doing data regularly. But pretty soon, it kind of comes together. And once things start to move, it gets momentum and we can continue to move it forward. Now, what's UAMS's role in this? Well, you know, the University of Arkansas for Medical Sciences is, I believe, one of the state's greatest assets for its health. I believe that it is. It should be. I believe that it is. And I like to kind of keep things as simple as we can. As a university, we're in the knowledge business. I mean, that's the fundamental basis for a university. To develop new knowledge through research, to transmit knowledge through academic programs, to teach, and to apply knowledge for the benefit of humanity. That's the purpose of a university. Of medical sciences, we're a special purpose university. We exist for the purpose of developing, applying, and transmitting knowledge for the benefit of human health. That's the reason that we exist. And we should look at everything we do through that lens. And in our case, if we're to talk about the health of Arkansas or the health of Arkansans, we got to focus on where the biggest burden of ill health is. You know, it's like Willie Sutton, you know, why do you rob banks? It's where the money is, you know. We should be focused on what those biggest health burdens are: obesity, cancer, cardiovascular disease, etc. If the burden is felt disproportionately in a population segment, we ought to devote our attentions to how to address that issue. At the same time, there's a bigger issue here related, well, a different issue in some ways, which is the whole issue of diversity that Billy talked about. You know, we benefit from each other's knowledge. There's value in teams, and the value of a team is that each player has a strength and has weaknesses, and we want to capitalize on each other's strengths and cover each other's weaknesses. And we want to be able to develop the capacity to accomplish goals. We're going to do that better if we understand each other and if we communicate with each other and we capitalize on talent in the broadest possible way. To me, that's why we should emphasize diversity as a university, an entity that's devoted to knowledge. I don't think that those concepts are that complex. Exactly how we operationalize them, how we develop them, how we measure our progress, that's a little more complex. The other issue I'd just like to focus on, we're heavily weighted toward public health here, so I have to acknowledge something. What percentage of those factors that impact health are actually directly related to health care? People in this audience know? 20%. That's the generally, 20-25% is kind of the generally accepted figure. Most of those factors that add up to health are not directly attributable to the quality of health care that one receives. They're actually attributable to lifestyle factors, environmental factors, habits, all kinds of other issues. And we've got to embrace this issue holistically. We have to not place blame. We have to partner, and we have to embrace it holistically if we're really going to have an overall effect on health. We need our research to go in those directions. We need our policy, like There is no such thing as a smoking area and a non-smoking area inside a building. I mean, who didn't know that? I mean, you know, we have to be robust in the way we address the issue if we expect to really have an impact. Now, I want to make one final comment on the system. I'm a rheumatologist. I'm an internist and rheumatologist, and so I practiced for many years. Actually, in Georgia, I practiced during the first 6 years of the time that I was president at the Medical College of Georgia. And so during that time, I was principally seeing outpatients. And I'll give two scenarios, and I hope I can do this in a way that is not pejorative in any way. One scenario is, so two patients with rheumatoid arthritis. One has a master's degree, works as an executive with a large corporation, and sees me for rheumatoid arthritis. Spends lots of time on the internet, does his or her own reading, feels quite confident, comfortable calling me Dan. No problem calling me at home, understands that I'm supposed to apply my knowledge and experience to her benefit, that that's the nature of the compact between us. Now take another patient, an individual farm worker, educated to the 6th grade, uninsured, has the same disease, rheumatoid arthritis, is intimidated to come to the academic medical center and see the professor, and has trouble making eye contact with me, and calls me sir. Now, who's going to be a better advocate for their health in that setting? The first one. Okay. Who's likely over the long haul to feel confident in letting me know when something has changed? Some new symptom has occurred. I could tell you a circumstance of this latter individual who had a severe herniated disc in his neck and didn't call me for a month because he didn't think I should be bothered. Now, who's going to have a worse outcome over time? Am I a racist? Is the system biased? You know, I mean, there's so many issues embedded in those kinds of stories. I believe it's possible for everyone to be of good intent and results to be different. Now, who has the responsibility in this equation? Who has the responsibility? Does that patient have the responsibility? Is it his fault that he didn't call me? Or are there issues in the way we design the system to assure that it's accessible in the broadest possible way?